welcome to the last session of today's event on Seeing is Believing. This session is a panel discussion, and it's focused on looking ahead. So it's called Seeing into the Future. We're honoured to have a fantastic panel with us today, and you can see the panel participants up on the slide in front of you. I shall introduce each of the participants as I turn to them to ask them some questions. So I won't introduce them now, but I'll introduce them one by one as we go round. Before I introduce our first panelist, there are just a few housekeeping rules which will sound familiar. So you'll have noticed you joined with your mic and video turned off. Please use the Q&A function if you would like to ask any of the panelists a question, and I will try to pick up any questions that are coming through as we go along and field them as we go along. The session will be recorded and will be available for viewing later. And if you lose connection, log back into the virtual platform and rejoin using the link in the agenda. And if you have any tech support, either please contact using the email address or use the Zoom chat. So let me turn without any further ado to our first panelist, Tulsi Desai. Tulsi, who I'm sure everyone knows well, but Tulsi, you joined Aravind Eye Hospitals in 1981 as a member of its startup leadership team. Aravind Eye Hospitals now annually handles over 4.5 million outpatient visits and performs over 500,000 surgeries and other interventions a year. Over half of these patients receive care either free or at steeply subsidized rates. In 1992, you co-founded the Lions Aravind Institute of Community Ophthalmology, which has mentored over 360 hospitals in India and imparted management training to over 2,600 eye care professionals from across the globe. Tulsi's been an advisor on several national and international bodies, and you were IAPB Southeast Asia's regional chair and was founder of president of Vision 2020 India. Tulsi, I know that you've been one of the key people who influenced the Seeing is Believing journey, perhaps specifically after a phase 3 Vision Centre project, along with 4 other influential Indian organisations 15 years ago. More recently, the Collaborative Scale project has also demonstrated how quality, training and mentoring, especially as a whole team, can improve service delivery and expand access to services for underserved communities. So I was wondering if you could share a few thoughts for how you and the teams at LICO and Aravind Hospitals are seeing into the future and how you see the future developments of teams for enhancing eye care delivery in India. Tulsi.
Thanks, Peter. And I also want to thank the organizers of this event for this opportunity. Seeing is Believing played a pivotal role in the development of the primary eye care approach at Aravind. Now, Aravind's current network of 80 vision centers now handle over 700,000 outpatient visits a year, with every patient getting a live video consult with an ophthalmologist. We're also getting growing evidence from these vision centers demonstrating the possibility of universal eye care. That is, everyone in need of eye care getting appropriate care. SiB's support early on to establish 10 vision centers laid the foundation for this. And these vision centers alone annually handle over 100,000 outpatient visits, resulting in more than 4,000 cataract surgeries, 14,000 plus people getting glasses, and more than 5,000 people getting advanced care in the base hospitals. Then the more recent support through SiB Scale project that SiB provided to build capacity in other hospitals, that too had remarkable impact. We worked with 13 hospitals, and within the project period itself, these hospitals' performance increased by 48%, or more than 32,000 surgeries annually. And this grant of 200,000 resulted in this. not just for 1 year, but in perpetuity. Looking into the future, while the blindness rate has come down, thanks to IAPB and supporters like Standard Chartered Bank, the absolute number of blind and visually impaired continue to rise on account of growing and rapidly aging population. So a lot more needs to be done. So we see the scaling of these two SiB supported activities, that is primary eye care through vision centers and helping hospitals become more effective, to hold a lot of promise in enhancing eye care and improving it by several orders of magnitude. The emerging digital technologies and lowering cost of diagnostic equipment have the potential to democratize quality eye care and make it accessible to all. Lyco and Aravind are actively pursuing this. Aravind's model of vision centers are now being rapidly scaled across India and Bangladesh, both by the governments and other eye care providers. We are now adopting more impactful methods to help other eye care providers to significantly enhance their services. We're also working with tech giants like Google to harness the power of artificial intelligence and such technologies to be deployed at vision centers to benefit the rural masses. So overall, we are very excited with all these possibilities and certainly looking into the future. Thank you.
Tulsi, thank you very much. I think, I mean, a number of really important messages there, and obviously about the importance of digital technologies, but I think also the work that you've done in terms of supporting other organizations, so leveraging them to get the scale that obviously we're really going to need if we meet needs in the future. Claire, can I turn to you next? Claire Gilbert, you obviously started your career as an ophthalmologist in the UK, and in 1990 you joined the International Centre for Eye Health at the London School of Hygiene and Tropical Medicine, where you were co-director until January 2020. Claire's work has focused on research, teaching, and technical support, and your main research interest has been blindness in children in low and middle income countries. Claire's been technical advisor to several non-governmental organizations, including the Vision Impact Institute, the USAID Child Blindness Programme, and until recently, Queen Elizabeth Diamond Jubilee Trust. And most importantly, perhaps in this context, has been your technical advice to Seeing is Believing Child Health projects. So in that context, I think you went into the bank to present to the management committee during the inception of phase 5 on the needs for improved eye care services for children. And I know you actively helped IAPB in the development of the 5 key child eye health projects within the Seeing is Believing portfolio. So I wonder if you could give us a few thoughts from you now, in a sense, 10 years on from that, on how you see the future for child eye health in Africa and Asia, and particularly in the context of collaboration and cooperation for child eye health care. You're muted, Claire.
Thank you very much. It's a great opportunity to be here. And I really, really valued and appreciated the input that I could give and see all the really exciting work that's being done with support for Standard Chartered Bank. And I think the key learning from these very large programs on child eye health was they were bringing together different NGOs to work together to address the whole spectrum of services that children need, from community all the way through to the tertiary level. And collaboration was absolutely key to enable that to happen, not only within the NGOs, but also collaborating externally with a very large number of people, organizations, and agencies. And there were some excellent examples of working with ministries of health, because when I was asked this question of how I saw the future, I said, well, it's just 3 words: integration, integration, integration. And the the SiB projects that have just recently finished, several of those really showed how when services are integrated into government health services by building capacity, by providing training and equipment and guidelines and protocols and all these things, then that really means that you can scale up interventions on a very large scale. And I would give examples from Nigeria, where they work very, very closely with the Ministry of Health. Also in Indonesia, where newborn screening was integrated into primary care of newborns. Absolutely fabulous. They trained a huge number of midwives and other staff who were already there supporting and caring for newborns, and they added into that newborn eye screening. And also in India, so the SiB program in India, the whole thrust of that was integration from top to bottom in national policy, in state policies and programs, and collaborating very widely across all the relevant professional groups, other UN agencies, so UN, UNICEF, there was also involved professional bodies. So very much a very strong collaboration between all the different organizations and agencies that you need to provide comprehensive eye care for children, because there are just so many different strategies and there's so many children that I think this is really the way to go, is integration. Having said that, there's still a need to continue to develop and strengthen tertiary eye centers with expertise and equipment to be able to manage the complex cases. And almost 20 years ago, WHO recommended that there be one of these tertiary facilities for every 10 million population. And many countries are making great strides to achieve that, particularly in Asia. Other countries still need to do more to strengthen that capacity, and also to ensure that they are accessible, because these often tend to be in the capital cities, whereas we know in many low-income countries, 80%, 60 to 80% of the population live in rural areas. So access can be a big problem. And this is where I think building the capacity of secondary eye units, eye departments in general hospitals is absolutely key, so that they know which children need to be referred upwards, they know which children they can manage at that level, and also they could provide the location for follow-up. So children who need to go to a tertiary centre for cataract surgery could be followed up at a secondary level if the staff there were well trained and well equipped. It's once we get below these more specialist centres, which is where integration and collaboration are absolutely critical, particularly in the area of primary eye care for children, which has to be integrated to primary child health services, programs and policy. We've been working with WHO and we have integrated, well, the Tanzanians have integrated an eye module into the integrated management of childhood illness, which is WHO's program for child health, which is it's basically the blueprint for primary level childcare in over 100 countries. But at the moment, it does not include eye care. And I know Bangladesh has also done the same. And this is the way that you can take those services for young children up to the age of 5, really to scale. I think newborn eye screening is another place for integration. All babies, when they're born, they have their hips checked, their heart is checked, their fingers are counted, but there's no policies in many countries to include an eye examination. And we've been working with WHO on the evidence for including eye examination into newborn screening. And so hopefully that will become a global policy as well in the future. Programs for retinopathy of prematurity are all about integration. The newborns are in intensive neonatal care units, which are not provided by eye care providers. So that automatically means that it has to involve collaboration and partnership to ensure that those preterm babies are examined on time and that they receive the treatment that they should do. Again, policy plays a very important role. And just last year, WHO and UNICEF, for the first time, included screening and treatment for ROP as an evidence-based standard of care for tertiary level neonatal intensive care units. And I think this really opens the door for advocacy and for giving advice to ministries of health of how they can go about either starting in some African countries or scaling up in many other countries, effective programs for ROP screening and treatment. School eye health is also important. The issue of preschool age screening is really quite a complex one. And I think at the moment we don't quite yet know what to do or how to do it and whether it's worthwhile or cost effective. And I think this is an area that needs a bit more study first. So those are what I would see as the priorities going forward. And I just wanted to say that I think universal health coverage offers a massive opportunity for child eye care because it includes congenital cataract, congenital glaucoma, retinopathy of prematurity, strabismus, and amblyopia. I think that's right. So this means WHO are going to be making packages for the care of management of all these conditions, which will be made available to ministries of health. And I think that with this as a platform, it really provides an enormous opportunity for the NGO sector to work with ministries of health to help them to implement their universal eye health coverage. Okay.
Claire, thank you very much. And I think, I mean, as you said at the end, that real emphasis on integration and collaboration is absolutely fundamental to, I know, what the sector is going to be trying to achieve over the next decade. And obviously it's the core theme underpinning the World Report on Vision. So I think a lot of the learning that we will take from Seeing is Believing, I'm sure, will be really helpful in terms of that implementation. Michael, I know you're having connection problems. Can you hear us? Okay, unfortunately, I think Michael's having some connection problems, so we'll try to resolve that. But in the meantime, let me turn to George. Actually, and before I do that, just a reminder, if you have any questions for anyone on the panel, just pop them into the Q&A section, and we'll have an opportunity, I'm sure, to ask the panelists. So George Smith has worked for over 35 years in senior management for international non-governmental organizations. He's recognized as a leader in NGO management and international development. George served in a variety of roles for Special Olympics International, a US NGO headquartered in Washington, and you opened their first regional office in Beijing. From 2010 until now, George has worked for Orbis International, where he serves as the managing director for North Asia. And under George's leadership, the Orbis program has dramatically expanded its program portfolio in North Asia. And you've helped to position Orbis North Asia as a leading international NGO in China and strengthen relationships with the government and corporate communities there. The Seeing is Believing projects have built on previous project successes in China. I'm wondering if you could elaborate some more on how particularly the recent phase 5 projects, both the SteER project, but also the recent projects in Shanghai or the Shanxi Child Eye Health project, have built on previous learning. And how do you see the future for eye care delivery in China? George, sorry, you're muted as well.
Just the microphone, there we go.
Sorry, I thought the host was going to unmute. Well, thank you, Peter. First of all, I'd like to thank Standard Chartered Bank and IPB for their tremendous support in helping create 7 impactful projects in China and many more around the world. These clearly have allowed Orgus to work with tremendous hospital partners who've helped us align our work with the Ministry of Health, the National Prevention of Blindness Committee, to create sustainable models to prevent and treat avoidable blindness. Central to our project designs and focus for our SiB projects was the call to action laid out in the China 5-year National Plan for Eye Health. That plan specifically called for the government agencies and partners to work together in several areas, including increasing capacity in China's county level hospitals, improving cataract surgical rates, expanding optical and optometric service in China with a focus on refractive error and myopia. I think our 7 projects have clearly aligned closely with that, and it's made it easier for us to not only get the support of the government, but to use lessons learned and models in future projects. The SiB 5 Shanxi Cheer project, which focused on helping create and improve and expand a comprehensive provincial child health service model at the county level. There were tremendous outcomes from this project, and it was based upon lessons learned from earlier projects in terms of the importance of development of curricula, the importance of networking, the importance of getting government support across all sectors, not only health, but education, civil affairs, disability sectors. And they did a terrific job in that, that project, along with the other consortium partners, to develop curricula and models that helped us inform our newest project in Shanghai with the Shanghai Ningxia Child Eye Health Project. So it was very important lesson learned from there. Our SiB STEER project with the National Prevention of Blindness Committee and Professor Wang Lingli again aligned with the national plan and learned from CHEER by creating new standardized and sustainable training curricula and models for comprehensive eye care in county level hospitals. These curricula have been adopted, endorsed, and they will be used extensively in future projects in China and throughout Orbis globally as well. Currently, we're working on a phase 2 STEER project, which will again rely heavily on the information we learned in phase 1. And finally, our 2 SiB IAPB supported projects with Shanghai ENT produce similar positive outcomes that also use lessons learned from CHEER and other earlier projects. The first phase focused on child eye health, especially myopia in migrant and poor communities. And the current project is focusing on identifying and treating high myopia in rural county level settings. And we are also now working with Shanghai ENT and their leadership on a phase 3 project. So again, we'll be able to continue the legacy of this project in IEPB and Standard Chartered Bank, and again, use a lot of the lessons learned that we've had. So looking into the future, I think it's important to say that SiB and IAPB legacy will have a significant impact on our future work in China. All of our new projects will use the lessons learned, curricula and models created in previous SiB projects. They've been successful, they've been replicated, and so we know that we can use them. Additionally, we see increasing need to use technology to scale up our work, including using Orbis CyberSite resources that now include training curricula that were created in SiB projects, conducting online training by volunteer faculty, conducting remote blended learning courses, facilitating remote surgical mentorships, and expanding the use of AI and the use of virtual reality simulation. I think all of these, specifically in a country as large as China, are important for us to scale at a reasonable cost to any organization and any government. This morning, I listened in on the second module of a glaucoma blended learning course that we had over 100 participants in throughout Mongolia, even when they're in total COVID lockdown. It's an amazing and essential use of technology that we will continue to expand in China. Again, we thank IAPB and SiB for our wonderful government and hospital partners for allowing Orbis in a small way to help improve eye care in China. And we're looking forward to the future. Thank you, Peter.
George, thank you very much indeed. And I think, firstly, that emphasis on learning is really crucial, and the lessons that we've drawn across the project, I hope, are ones that we can take forward, not just now, but into that experience into the future, but also the sorts of experience you have on technology that you've just described at the end there, I think are obviously going to potentially be applicable much more widely than just than simply in China. Michael, I think you're back. Can you hear us? Michael? No. Hi, Michael. Are you with us?
I can hear. I can hear.
Fantastic.
Yes,
okay. Let's go. Let's turn to you next.
I'm with you.
Brilliant. Okay, that's great. That's great news. So, Michael, let me introduce you, and then turn to you. So, it's great to have you here. Dr. Michael Kochangi, you trained as an ophthalmologist from the University of Nairobi in the late 1990s, and got a master's in public health for eye care from the London School of Hygiene as well. In 2019, you completed a fellowship in global health leadership with the Afya Bora Consortium, focusing on health policy issues in Kenya. You hold the position of Senior Deputy Director of Medical Services and Head of Ophthalmic Services Unit at the Ministry of Health in Kenya, where you facilitate and coordinate the implementation of public eye health policies. And you've held that role for, I think, close on 15 years. So I know Seeing is Believing funded several projects in Kenya over many years, including one of the child eye health projects and recent supports to county level eye care service development. So I was wondering if you could give us a few thoughts on how this Seeing is Believing support has helped eye care services development in Kenya, and how you, particularly from a Ministry of Health perspective, are looking into the future for eye health. Michael. Michael.
So thank you very much for the question.
Yeah.
I want to confirm that SiB, Seeing is Believing, did. Yes, you can hear me.
Yes,
Seeing
Michael, we can. Yeah, we can hear you. Yeah.
Yeah. Okay, so Seeing is Believing initiated a series of projects, including child eye health and many others in different aspects of health system strengthening. Now, what I get, or what we took from there, is the fact that beginning and an end, it's really specific agenda to deliver some deliverables, and mainly in the aspect of health systems, it's to initiate, or rather look at the capacity we had as a towards building the capacity to a certain level. If I were to recap briefly on child eye health, I think there were a series of skilled workforce that was were clearly obliged to take the effort forward to higher levels. Up to today, I know the workforce that was trained and the systems that were put in place have seen the work of child eye health moving on to some extent, or to parts of the country or districts or counties where Seeing is Believing also took some projects. They were specific, and they would look at the context of Vision 2020, in the aspect of workforce, equipment, infrastructure, and put in systems or facilitate systems for patients flow, for uptake of services. Now, the fact that there was a beginning and an end to the project called upon us as a ministry to take up the project moving forward, because we did not expect Seeing is Believing to continue support as government or ministry not having an agenda to build it on top of that, which is one of the best lesson you can learn, that it's good to support a system, build it up to somewhere, and let the government continue driving it. And then at another point or in another aspect, especially when you realize which is the weakest point, then that would be the other approach to take, and build on it up to somewhere where the government can take it up. So as government, we have picked up on what Seeing is Believing started or initiated, or what we collaborated with, to ensure that we move forward in a better way. Looking forward still, we as a country have a change in approach, and we want to deliver universal health coverage, especially with a primary healthcare approach, getting more and more into the community, or delivering primary healthcare services. That way we feel it is much more cost effective with better returns. And even with what we were able to do with Seeing is Believing, for example, in the last few years, it has been possible to mobilize communities and engage them to see, or for them to take eye care as their priority and agenda. And this is also probably an area we think we should move forward with in partnership with Seeing is Believing. But by and large, the fact that there has been health system strengthening, that is the best approach. Thank you.
Michael, thank you very much indeed, and for joining us today. And I think particularly emphasising the point really that Claire made, that one of the strengths of the Seeing is Believing programme has been its integration, not just within the sector, but with Ministry of Health. Hi, Michael. Yeah, thank you very much for joining us. With perfect timing, we've been joined by Professor Wang Lingli. Professor Lingli, can you hear us?
Yes, I can.
Fantastic. Perhaps I can turn to you now. I'll just introduce you and then ask a question of you. So Professor Wang Lingli, amongst many senior positions, serves as the director of the Beijing Tongren Eye Center. He's the Dean of the School of Ophthalmology, the Capital Medical University, and head of the National Committee for the Prevention of Blindness. And other positions include president of the Asia Pacific Academy of Ophthalmology and president of the Chinese Ophthalmologist Association. He's many awards, including the Ophthalmologist Top 100 Most Influential People in the World of Ophthalmology, and was honored as the Young and Middle-Aged Experts with Outstanding Contributions and the National Model Worker. Professor Wang Lingli, as the representative of the National Committee of the Prevention of Blindness at the China's Ministry of Health, how do you see the future for eye care service delivery within the new national plans of the Chinese Health Service? And how did the STEER project that Seeing is Believing supported fit with these plans? Professor Lingli.
Yes. So right now, this year is the end of the 2020. So we just did our summary about the 2020, and we started to make the next 5 years plan under the government's instructions. And now we move our focus from the cataract and the common blindness linking course to the chronic disease caused blindness, just like the diabetes retinopathy, high myopia, glaucoma, and some things related to the systemic chronic disease. So that will be another very important focus in China, because we get the aging population, and we also the lifestyle changes so rapidly. We get more and more diabetes, and something the chronic disease. So the situation changed a lot. This is the first thing. And the second thing is the government right now to set up the insurance for the general populations. For the cataract, almost 100% covered by the government. So the cataract is not the big challenge now. It is not the big challenge anymore. So we have to move to our, the plan is preventions from the cataract to the glaucoma, to the diabetes retinopathy, and other fundus disease. And also in China, we have big numbers of the ophthalmologists, but unfortunately, the distributions is very imbalanced. In the East Coast area, in the big city, that is occupied 80% of the females ophthalmologists there. So we still lack of the ophthalmologists in the remote area. So we have to make some policies to encourage the doctors, eye doctors, move from the big city to the remote area. And another thing is we have to do some project like the steel projects to training the county levels eye doctors team and increase the service of the eye service, eye health service in this remote area. But anyway, the next 5 years plan just start. We just finished first round of the discussions about the next 5 years plan. And recently also we get some informations from the WHO about the next plan for the whole world's eye health. So also we will follow the new informations, new policies from the WHO and the IPB to make our the eye health plan. So something is ongoing. So we need some new informations from our WHO, IPBs, just like some new new measurements, just like the ECSC. Yeah, that is something new. We use the CSC. This time we have to use the effective character surgery coverages. Something the new measurement parameters to do the evaluations for the blindness prevention in China. And also the trachoma already eliminated in China. That is a big achievement we did 4 years ago. So something has changed dramatically in China. Because unfortunately, I just joined this meeting. I did not get the other people's presentations. I lost the opportunities. So I just want to see something like this. Thank you.
Professor, thank you very much indeed, and thank you very much for your support to the program over the years as well. So thank you. So finally, let me turn to Karuna Bhatia, who's been head of sustainability for India since March 2009 for Standard Chartered. Before this role, she was the business head for microfinance at Standard Chartered, and before joining Standard Chartered, Karuna worked with ANZ Grindlays Bank for 8 years, where she held a number of senior positions. In her personal capacity, Karuna sits on the board of United Way of Mumbai, one of the leading non-profit organisations that endeavours to leverage corporate, employee and leadership talent for community development. And she's also sat on the board of trustees for Sightsavers India for 3 years, and sits on the Confederation of Indian Industries National CSR Committee and National Water Committee. So Karuna, you're obviously got a senior role at Standard Chartered in India, and I know that the bank in India, through the 2% profit tax, will continue to support eye care development after the end of the Global Seeing is Believing programme. So from your perspective and the perspective of the corporate world, if you're looking into the future for the eye care sector, I wonder if you could tell us what you see, not just from a CSR perspective, but also perhaps from an economic perspective as well. Karuna.
Thank you, Peter. It's wonderful to be a part of this panel with the Seeing is Believing program globally going away, saying a big goodbye. But I'm very happy in India, the program continues. So the legacy moves on in India under the nomenclature of Seeing is Believing by Standard Chartered. I think, you know, from a corporate perspective, I think the investment that we have done with a variety of projects, I think India has benefited with a variety of projects that we've done. Claire spoke about the Seva model, you know, that we had in India, where we had 54 hospital under the mentor-mentee partnership, which has done wonderfully well. We've also had, you know, projects which have looked at technology as a cutting edge. We've looked at, you know, rural areas where there is a need. So I would say that the assortment of projects of Seeing is Believing have all happened in India over the past many years. As we look into the future, under the 2% rule that you know, highlighted, Peter, a large part of our investment will continue to be done in Seeing is Believing. The brand that has been built in India with the program needs to continue. And we today stand out as, you know, the leading corporate who has made investments in the eye care industry. And with the numbers going down, I think, you know, the brand has in itself been able to demonstrate how the investment that have been done over the past so many years have really impacted in the numbers of blind people going down. How are we looking to really continue with the program is we've signed up multiple partnerships with leading eye care organizations. And we have tried to do two things. One is build capability in the eye health sector, which today is lacking. We've tied up with leading eye care partners like LV Prasad, Arvind, Tulsi is on the panel today, Dr. Shroff's Eye Care Center, where we have looked to support adolescent women, people from the underprivileged background, to gain capability and training to become allied you know, professionals. Now, these are 2-year programs, you know, post which they will get jobs in hospitals from the areas where they come. So this is a big part of our investment. These are 2 eye care academies, which are called the Shroff's Standard Chartered Eye Care Academy and the LV Prasad Eye Care Academy. You know, we are watching these programs very closely, both these projects, and we are keen to see how we can represent to the government how we really helped in skilling the underprivileged people into the eye care industry. So, you know, that is one big intervention, you know, that we are wanting to talk about. The second is, of course, the technology. Now, you know, my worthy panelists spoke about how technology is important. And I think the pandemic has only made us realize that the technology continues to play an important part. So we've got a tie-up with LV Prasad where we're looking at establishing close to 60 vision centers, which are called the futuristic vision centers. Tulsi spoke about the partnership with Google on artificial intelligence, and our partnership with LV Prasad is similar, where the vision centers are going to be established with high-end technology, which doesn't require the patient to really cross multiple kilometers to go to the hospital to get his eye checkup done. And one level further is that the equipment and the technology will help the patient connect with the hospital directly and be able to get answers which otherwise may have been really difficult, time consuming, and he may not have wanted to do it for want of, for giving up a day's labor's job, a pay. So I think, we're very happy that we're moving in two directions. One is, of course, building capability, and the second is providing technological edge. The other thing that, I'd like to add is that the bank globally runs the Future Makers program, and we have tried to build an underlying line into our Seeing is Believing program with Future Makers, which is, it would cover adolescent girls, it would cover people who come from the underprivileged background and who are wanting to establish themselves in getting a job. From the socioeconomic aspect of what you asked, is today we are very much aware, and there are multiple studies that have been that are out saying that a person who cannot see, cannot earn, cannot get any money into his house, and as the population is aging, it is very important for us to be able to get people their jobs back, and that can happen with getting their eyesight back. So preventable blindness, as we all know, is not a difficult challenge. If addressed properly, it can help multiple problems subside and get people back into the earning ladder that we all want to see. Peter, I'm very happy that I'm sitting in a country where the legacy is going to continue, and I wish IPB all the best. I've had a great relationship with IPB, with Sally, with a lot of people there. So my best wishes to IPB, and I want to say thank you very much for the lovely partnership that I have seen over the last decade. Thank you.
Karuna, thank you so much. And I would very much like to echo that myself, and thank you for the partnership that we've had. And it's fantastic that Seeing is Believing will live on in India and that you'll be able to continue the program there as well. So that's great news. I think we've come to the end of the panel discussion. One of the themes that I think really ran through what everybody was saying was the importance of learning from the experiences we've had. And I mentioned this morning that we plan to try to capture as much of that learning as possible, and we have created a place on our website where the learning from the projects is present, and so you will be able to go in and get those experiences and those learnings from the projects in the future. So at least that experience hopefully will still be available to the sector in the future. I would like to particularly thank all our panelists for their contributions today, which have been, I think, really insightful about the experience of Seeing is Believing and what the future will hold, but perhaps even more importantly, for the support that they've provided the program over the past many years, and in every aspect of what we've done. And without that support, the program couldn't possibly have been as successful as it has. So I'm going to, Professor Lingli. Sorry, you're muted.
Yeah, can I add something here? Because here is my thanks to the office to set up the SiB project in China. That project really good help to do the training ophthalmologist, the team in the remote area, especially in the county level. That is a bigger contributions. So here is my thanks from the Chinese Blindness Prevention Committees, and also we are so happy have the relationship with the IPB and with the NGO. So we need the continued collaborations with the IAPB and the office and some NGOs. Thank you very much.
Thank you so much. Claire.
Yeah, I'd just like to add my word of thanks as well to Standard Chartered Bank, because I think a lot of the work that they have done has been absolutely fantastic and provided a huge amount of learning. And I just wanted to thank the team at IAPB who have been so steadfast in their leadership and in ensuring quality and being encouraging and all those good things. So Sally in particular, thank you.
Thank you. Well, thank you both, and thank you everyone for that partnership. And I'm sure the partnership between IPB and all of us will certainly thrive and continue in the future. I'm going to take the opportunity now to turn back finally to Victoria and Sally to close out the day for us.
Sally, I think you're on mute. Are you going first? Or?
Hello, yes, I'll go first. Thank you. Well, thank you to all our panelists, and really sorry we ran out of time for any Q&A. It was really a rich discussion, and sorry, Michael, that your connection wasn't so great, but Tulsi and George and everybody, thank you so much, and also to Claire and Professor Lingli and Karuna from India, from the bank, thank you so much. That was just wonderful. I have really enjoyed today. The whole day has just been surpassed my expectations, and a lot of people have stuck with us through the whole day, so through all the 4 sessions. So I think it's been really good fun. I've still continued learning. As Peter said, you know, we learn a lot from each other, and I really have learned a lot today from you all. So, I mean, but this is, you know, this is the end of our virtual closing event for the whole of Seeing is Believing. I cannot believe it. So we've reached the end. And so it's really difficult to know how to close out. So I can't really think of anything to say except thank you so much to everybody who has worked so hard over all the years that Seeing is Believing, even before I arrived, you know, all the years. Because there are people here who have seen it through, you know, from the beginning, from those first cataract operations with the IOLs. And I like to think eye care is progressing. There is progress. We can see change. There has been great learning, and we are moving forward. And sometimes we think we're moving forward quite slowly, but at a sort of a reflection event like this, where we do all look back, you can see that there has been progress. And I think eye care should, you know, hold its head high and say, yes, we are delivering, and we've got some great ideas, great new innovations and things out there, and we can do better. So I think, yeah, we've just all got to get back to work as well and deliver more, because there's still such a great need. So thank you, everybody. That's all I'm going to say. And I'm now going to hand you over to Victoria in her sparkly Christmas.
This is actually for Sally.
Thank you.
So very short from me, guys. I'm aware we're running over, but on behalf of the bank, thank you to all of you for such a wonderful programme. And even though I'm quite late to the party, joining the bank back in 2018 for Seeing is Believing, I have been with the bank since 2007. And I said back in Tanzania that I was an employee giving money, fundraising, donating. And something that SiB has done for the 90,000 people that work at the bank is create that legacy and make that awareness for eye health. And we don't talk about that very often in this forum, but you really do have an army of ambassadors at the bank, and who have left and who join. So regardless of where we go with Future Makers and our support in other areas, that remains, because people are incredibly passionate about eye health, and that is because of Seeing is Believing, and that is because of all of you here. So thank you very much. I will miss it very much, and I think everyone's done a wonderful job.
Thank you all ever so much, everybody. Bye.